Dr. Bowers, if you will, for me, I'm going to have you stare into this camera. Say your name, position, title, everything here with the hospital.
Jacquelyn Bowers. I am a physician and assistant professor for the Department of Emergency Medicine, and I'm the director of emergency service for Ochsner LSU Health System, North Louisiana.
How does a patient brought to your emergency room for a mental illness differ from other medical emergencies you might see?
So patients that are brought in for mental illness are treated differently in the sense that they require privacy so that they can share what may be a very intimate circumstance that they're going through. So whereas a patient would normally come into the ER and be triaged up front and then go back out into the waiting area and then be called back to the nurse for their initial vitals and first provider eval by a mid-level or physician, patients that come in for an acute psychiatric crisis are immediately greeted by a triage nurse and taken to a safe, private observation area where they can have an evaluation that is not out in the open, and additionally seen more rapidly in general by a board-certified emergency physician, so that this de-escalates problems early on by seeing the patient right away and letting them know that their issues are important and also not out in the open.
Are emergency rooms really designed to deal with mentally ill patients?
Some emergency rooms are better designed for this than others, although I feel this emergency department has done a good job in that because we can take the patient immediately back to a safe observation area so that they can be evaluated quickly and triaged quickly, and this is away from an open waiting area.
You all are never going to turn away any patient in an emergency, but this isn't the ideal place for a person suffering a psychiatric crisis, is it?
That's true, because while the patient is coming in for a psychiatric illness, we are still seeing patients for acute traumas, acute strokes, acute heart attacks, and all the other various complaints that patients come in for. But the psychiatric crisis is equally as important as these others. And so at times, I feel that psychiatric patients could be better benefited from a dedicated hospital to take care of their needs, separate from the other.
Does it take more time, more resources to diagnose and treat a patient with a mental emergency versus someone who comes in with, say, chest pains or a broken arm?
Certainly, it's a more complicated process, and that many patients are coming in with a myriad of issues. So, for example, a psychiatric patient may have hypertension but has not had an opportunity to fill their medications, and so now they have hypertensive urgency along with their depression or an acute episode of bipolar. Diabetes, just not having access to their meds, things, whereas if you were here simply for hyperglycemia, I could say, okay, let's do your labs and we're going to start fluids and give you the appropriate insulin and go from there. But it's much more detailed because it's our job to see that patient and exclude any acute medical issue before we proceed with the psychiatric evaluation.
How many floors do you have here at the hospital?
10 floors.
10 floors, one floor dedicated to psychiatric patients.
We have one floor dedicated to psychiatric patients in addition to a psychiatric crisis unit that is also on the second floor, and then a portion of our ER.
Is it also a matter of when you get a psychiatric patient into your emergency room and then you know that we're going to have them stay, is it more difficult in finding them a room to stay versus someone who comes in with a medical injury? You have much more, once you've triaged them in the ER, a medical patient, you might be able to find a better place for them, but for the psychiatric patients, I imagine it's much more difficult at times.
It certainly can be much more difficult, particularly in a pediatric population. In our adult population, because of our psychiatric crisis unit, we do have much more bed availability, but nonetheless, depending on the need, you can certainly be overwhelmed quickly because you simply don't have as many beds.
And so they may be staying in your emergency room or another part of the hospital longer than what a typical medical patient might.
That's exactly right.
And I imagine that causes problems for their treatment and care.
Exactly. We want everyone to have a private space and more nurturing environment than what you can experience if you're having to stay in the ER for an extended period of time. So having that private room and a dedicated area for psychiatric care just improves the patient's overall health care.
What type of mental illnesses are we talking about that you're seeing come into your emergency room most frequently?
So I would say the most common diagnoses would be depression, bipolar disorder, schizophrenia, certainly substance abuse disorders, PTSD, suicidal ideation. Those are the most common.
Explain to me what's a psychiatric emergency.
A psychiatric emergency would be any condition in which the patient becomes overwhelmed to make good decisions. They become disabled by their process, and they are seeking that care in an acute fashion. And if not intervened, it can certainly degrade and progress to become worse.
A person suffering a mental emergency, a psychiatric crisis, do they really know what's going on around them?
I think that that's an individual situation. Some people can and some people do not, depending on the gravity of the situation, and certainly their underlying disorders and stressors, so that's very individual.
At times for someone who's suffering a psychiatric crisis, then even finding themselves encountering police or EMS or an emergency physician, is there a risk of their situation being escalated in those circumstances?
Certainly, and I think anytime when you're already under stress and then you come into an unfamiliar environment with unfamiliar people, it certainly is a setup for increased stress and perhaps an escalation.
We're talking about illness, right? When we
Right.
talk about mental health. And while that mental illness doesn't manifest itself like maybe heart disease or pneumonia or cancer, we're still talking about a treatable disease.
Absolutely.
Do you think we really understand that, though, as a society, that this is an illness and a disease and that it can be treated?
I think that continues to be a tremendous stigma attached to mental illness, and that many do not approach it as a true medical problem, while it is very much so.
A lot of the people you see are in trauma. It may not show itself like a gunshot wound or the victim of a car accident or someone coming in with a heart attack, but these people are in an emergency situation.
That's right.
What is the first thing that you do when you get someone into your ER suffering a psychiatric crisis?
So the first thing that we want to do is triage the patient. So the patient is greeted immediately by a triage nurse, and for example, if the patient presents by EMS or by police custody, best scenario is for the triage nurse, along with the board-certified emergency physician, goes in concert with the patient to gather the history as quickly as possible and reduce the repetition that's required for the patient to provide the history. So whenever possible, we like to do this all together. But regardless, the patient is triaged very quickly by an RN, and then as soon as that triage occurs, then we can place orders for appropriate labs, provide any sort of medication, IV fluids, whatever the patient needs immediately, and the patient receives a bed, and we determine further, do we need, for example, imaging such as x-rays, MRIs, CT, anything that we need to do to exclude, like we're talking about other acute medical processes.
Someone suffering a psychiatric crisis isn't necessarily dangerous or violent, are they?
Correct. Many patients are not dangerous and violent just because they are suffering from an acute crisis.
But it can seem frightening to a person to see a person who, if I've never witnessed someone suffering psychosis, it's easy for me to fear.
Absolutely. Because it's different from anything you've experienced, so it's natural for us to approach that with fear.
Most people have never seen someone in a psychiatric crisis. That would probably include police and first responders for the most part as well.
So I think that it's important that we all have training, because that's how we learn how to approach patients when they are in an acute psychiatric crisis. And from an emergency medicine standpoint, it's important that we all have that background and that we understand patients, that they're coming in as a whole and it's not just the psychotic episode, but you approach them in a safe way and in a way that de-escalates their situation.
You all, as emergency room physicians, get that kind of training.
We do.
How to deal with people in a psychiatric crisis.
We do, and so everyone in the emergency department has nonviolent crisis intervention training. And in addition, depending on your background as a physician, I mean, years of training, and how to just simply interview patients, how to help them relax, what to do if a situation is becoming more out of your control. And so it should not be a situation that you go into that you don't know what to do. So you've planned and trained for these situations.
The crisis intervention training that your physicians go through, I imagine your nurses go through it
Absolutely.
as well. That's in addition to your
Yes.
medical training and education,
Absolutely.
correct?
Yes,
Because there's an understanding that you're going to see these patients in your ER.
that's exactly right.
And it's critical to help.
Every day you're going to do this. So you need to have the tools in your box so that you know how to work with these patients and provide them with the very best care, a compassionate intervention as well, and that you are also safe and that the patient is also provided safety.
Because those tools help protect the patient,
That's right.
they help protect you, and they protect the rest of the population, I imagine, in the ER.
That's absolutely correct.
How often do your beds in the ER fill up with patients suffering mental illness?
So it is not uncommon for us to have a very busy psychiatric portion of our ER. Dr. Patterson, our lead psychiatrist, is very helpful in helping us to move patients as quickly as possible out of the emergency department. But there's a constant flow of psychiatric patients. There's a constant need.
There's a perception that I think if someone's just watching this, they're going to think the psychiatric patient coming into your ER is probably a homeless person or someone who's chronically suffered substance abuse. Is that who you're seeing, or is there a wide population that you actually see?
There is a very wide population. That could be you. That could be me. A psychiatric illness does not skip over any walk of life. This is just like heart disease. We all are susceptible to it. So we have to always remember that it's not something that we should look at, they did something wrong, or it's their fault, or if they had done something better here. You know, many times it's something that is a biological, chemical problem, just like hyperlipidemia is.
And we're pretty good at society at still looking that way, aren't we? We often still do look at psychiatric patients, people suffering with mental illness, as having done something wrong.
That's right.
Does that deter, you think, in your medical opinion, some people from seeking help and then ultimately ending up in your emergency room?
I agree with that. I think that it is very common throughout our community and society that we are afraid to seek treatment when we know that we could benefit from it. We're afraid of what will happen in our jobs or what the sequela will be.
If my arm's broken, I'm going to
You
go
would be
see
right in.
If
That's
I
right.
think I'm suffering a heart attack, I'm coming to see
Exactly.
you. But I might not if something is going on in my life or my head that's wrong.
We're worried about the bias that we will have to sustain from our employers, our family, our friends, just in the community.
Yeah. How long can a patient end up spending in the ER that's suffering psychiatric crisis?
So whatever the patient needs is what we will provide. So there's not a set time where, okay, we've reached this limit and now you have to go. Sometimes you're here for a very brief period of time. You may go directly to psychiatry within an hour. You may be here for hours. You could be here overnight if you're seeking placement, for example, in a pediatric case.
The patients you see in your emergency room suffering a psychiatric episode that are on the edge or in full-blown crisis, do you worry about how they were treated before they get into your ER? Do you worry about the manner in which a patient has been transported to your ER? Does that affect their care once they get to you?
And certainly, and I think that we can all say that how we were interacted with throughout our day impacts where we are right now. So if you're in an acute psychiatric crisis and you are not handled in a way that's de-escalating, then that's likely to worsen how you are when you arrive.
I want to go back to the population of people that you see. One thing that you and I talked about for a little bit on our phone call, you're seeing more adolescent patients in the emergency room. How troubling is that?
It is troubling, and I feel that it is occurring more frequently and at a younger age. And I do feel like some of this is coming from the mandated separation that we have secondary to the COVID pandemic. And also, again, patients are not able to seek that care outside of coming to the emergency room as readily as you would be as an adult saying, I think I need some help and getting an appointment.
Things that we might be doing wrong in terms of a society, and things that we could do to improve the situation that emergency room physicians like yourself see in having to handle this volume of patients and the patients themselves. What could we do better to help you all and to make sure these folks don't get here in the first place?
So I think one of the biggest things that we can do as a society is make it so that there is not a stigma and there's not a punishment for seeking help. In addition, we need to have more access so that you do not end up in an emergency department and you can have that intervention when it's not as big of a situation. In our area, we're very excited because of our partnership with Oceans Behavioral, with Ochsner partnering with Oceans, forming the Louisiana Behavioral Health Hospital. We are going to be able to provide a lot more access to patients, whereas we have previously not been able to provide that access. And this is really going to open up a lot of improvement for our psychiatric population.
Because the treatment is so much different.
It's so much different, and it's a private, nice, calming situation where there aren't ambulances coming by and stretchers rolling by. And I mean, you can imagine when you're under the most stress that you've experienced and all this is in your environment, it's much more difficult to be able to relax and have that more one-on-one interaction with the patient.
What happens to many patients when they lose access or cannot access the medication that they were on for a period of time?
I think it's very difficult for patients to manage that, just as it would be very difficult for us to manage any other medical illness that we have without our medications. And so they're certainly likely to need to return.